Cybercriminals are now targeting your healthcare data more than your financial data. I'm Scott Schober, and find out why in this week's 2-minute cybersecurity briefing. As banks and larger retailers have taken steps to harden their networks, hackers have turned their attention to healthcare providers. Just recently, Premera announced a breach that took place last year may have exposed the personal and financial data of approximately 11 million customers. Recently, the nation's second largest health insurance company reported the information of approximately 80 million people was exposed to hackers. There are several reasons hackers have focused their attention on healthcare companies, even though companies in the industry don't usually handle financial transactions. Many patients use online payment options, which means their records may have information such as bank accounts and debit or credit card numbers. Even without financial data, criminals can use personal data to commit crimes such as identity theft and insurance fraud. They can also use email addresses to target patients for phishing scams. While email addresses are easy to change, other information such as names, birth dates, physical addresses, and social security numbers are much more problematic if compromised. I recently presented at Connected World Cybersecurity Conference and had a chance to speak with James Driley, Executive Director of the School of Criminal Justice and Public Administration at Kean University. He has some very interesting things to say about the security and privacy of our healthcare records.
Youngest child, our daughter, a few years ago, about 3 years ago, had her identity information taken through a very, very large national health insurer. And we receive regular updates from them, so they're good that way. But yet nobody knows when any of that information could be used. So, it's something that, it's like an illness now. You have to start to learn to live with it, and it is frightening.
Healthcare companies keep and share patient records. As part of the Affordable Care Act, healthcare providers are required to maintain their records electronically and share the data with other healthcare providers. Sharing information has real benefits for providers and patients, but it also increases the risk of exposure. Because healthcare providers share data, if a criminal uses a patient's data to obtain prescription drugs, the false prescriptions could become part of the patient's record and affect a doctor's medical decisions in the future. Healthcare companies are a soft target. Companies in the healthcare industry are more focused on the regulatory compliance than security. White Hat Security recently revealed that only 24% of known security flaws in the healthcare industry are patched at any given time. Even more troubling, the average length of time for a healthcare site to fix security problems is a whopping 158 days. Healthcare companies must take steps to harden their networks against hackers. Security breaches can have long-lasting effects on patients' financial and physical health. Subscribe to this podcast on iTunes or YouTube for more cybersecurity news and tips. Until next time, stay safe.